My name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute and human service professional for nearly 20 years. I think it's important to dissect the family disease concept and how it relates to how this trauma impacts family members' brains. Now, we've all seen images of the identified patient's brain. Now it's time to understand the biological and neurological impact this disease has on family members' brains. And it's really an understanding about the impact that chronic stress has on our brains. Because stress is caused by adrenaline and cortisol that hit our system and leave. And they're supposed to be good, healthy chemicals, hit our system and leave after 3 minutes. There's a wonderful book called Why Zebras Don't Get Ulcers by Robert Sapolsky, where it mirrors a zebra getting chased by a lion. Adrenaline and cortisol hit the system, and for 3 screaming minutes, the zebra gets the heck out of the way. Good system. But what happens when adrenaline and cortisol hit your system constantly? You can actually teach your brain to live in a chronically threatened environment. And I know that's how some of you are feeling to this day. Just because of the chronic stress that you've been on, you can scan the environment or the temperature of the room like that. And that's the impact of chronic stress. Because what we know is that family members who have a loved one struggling with disease, family members are 5 times more likely to be in the hospital than your average human being. And that's the unhealthy impact of adrenaline and cortisol constantly in your system. Because what we know unequivocally is chronic stress, chronic adrenaline and cortisol shuts down the frontal cortex and hyperactivates the limbic system. And so what does that sound like? When the frontal cortex doesn't work. And you wonder why we say this is a parallel process where you have the identified patient and the family both without properly working frontal cortexes. And it's also exactly why there's so much emotional intensity, where oftentimes in your house and in your conversations, you have people reacting at each other because you've got 2 parties without a properly working frontal cortex and emotional regulation reacting at each other. And why it's essential, especially early on in this process, to have a third-party vetted professional and following the professional's recommendation. Because what we know is emotional intensity skews objectivity. We know that. That's a human being trait. They tell us in our profession and in doctorate school and getting your therapy license, you can be the most elite specialist in the world and still should never treat family because you can't see them accurately. And it's just a human being response. Emotional intensity skews objectivity. And the brain disease part of this, especially for family members, is chronic stress. The chronic adrenaline and cortisol in your system teaches you to live in this chronically threatened environment. And that is the PTSD symptoms that we need to help you with. This is just like when I was at the height of my disease, that my mother called my house every morning at 6:30 a.m. And I thought she was just being the overbearing mother. She still is. But when I went through this recovery process, I found out she was just calling to see if I was alive. And that wasn't an overreaction. That was a very appropriate response to where my disease severity was at the time. And what other scenario other than war, and I'm not comparing war and the disease, but what family members and loved ones go through, what other scenario other than war do family members and loved ones have mortality level stress day in and day out? That intensity day in and day out. Don't you think that's traumatic? Trauma doesn't have to be one lightning bolt or gunshot or car trap or magnificent event. Death by 1,000 cuts is still a death. It's still traumatic. And families need to be validated and understand that that trauma, that chronic stress, the impact that that has on your brain steals your self-awareness. That emotional intensity skews objectivity, and the precise reason that both the identified patient and the family needs to follow professional recommendations.